Hi guys!
All right, guys. Hi, Philip.
I can.
Hi, how are you? Yes,
Fine, fine. Thank you. Thank you.
yes, for the benefit of our audience here, I've known architect Philip for more than 4 years now. He was introduced by a common friend, and he was trying to sell his townhouse, which incidentally we were able to sell and also lease out at the same time. And I remember when we visited Philip and his wife, little did we know that what was going to be a professional relationship would blossom into a friendship. And I've seen his dedication and passion in the work that he does, and also how he engages with his clients by the results of his work, which always provides excellence. We're also joined here by Dr. Joel Santiaguel. He is a pulmonary intensivist at PGH, a frontliner, and at the same time a professor at the UP College of Medicine. He's here to talk about an innovation that will be a medical game changer in the way we battle COVID-19. He's also our brave frontliner who's witnessed the battles of our patients, enduring and looking at it firsthand the effects of COVID-19. So I'd like to ask Dr. Santiaguel first. Dr. Santiaguel, for the benefit of our guests here, what does a pulmonary intensivist mean? It may sound complicated, but what do you actually do?
First of all, good afternoon or good day. So, a pulmonologist per se would be the one involved with any lung problem, be it asthma, tuberculosis, lung cancer, COPD, any and pneumonia. So, most patients with lung diseases, they are seen by the pulmonologist. Now, to become an intensivist, you would be the one who would be handling critically ill patients. So you're the one mostly in the ICU monitoring and managing patients who are critically ill. So these are the ones who have all different types of tubes inserted in them, especially the one inserted into the mouth going to the lungs so that we can assist the breathing of the ill patients.
Wow, so that's really very. How many of you would be in the active practice right now?
In PGH where I practice, there are three teams of three intensivists or pulmonologists each who go on duty weekly. So one team per week, then 2 weeks off. So we are the ones handling more or less 60 patients at any given time in the wards and in the ICUs of PGH.
So three teams handling 60 patients. I'm sure right now with COVID, nagdodoble or nagtitriple pa siya.
But the difficulty is that the ones we have not confirmed to have COVID, so what was termed before as PUIs or those who are suspected to have COVID, actually, if the patient has known COVID or has been diagnosed swab positive, then it would be easier. But the more or scarier patients would be the ones who you do not know. So you haven't
Mm.
confirmed that they have COVID, you're unsure, and as such, we would need to protect everyone and be concerned and be worried that you may get infected anytime.
Yeah, I'm very curious lang din, Dr. Santiaguel, no, as someone who's right there in front, a frontliner in front of the battlefield. How would you describe our readiness and the readiness of our healthcare industry in facing a pandemic with this magnitude?
Well, um, we can never be really fully prepared. And as you can see in other countries, in the US, and Italy, France, Germany, despite them having very advanced healthcare systems, you would see that they have been overwhelmed because of the number of cases. So Our country, fortunately, probably because of the government's efforts, there we have not seen that deluge of patients. So so far, we've been able to manage the number of patients going in. So not like the thousands or millions that the U.S., for example, has. So the problem there is, even if they have advanced healthcare systems, this is overwhelmed by the number of cases. So sa atin, fortunately, not that many cases, or the hospitals have not been overwhelmed. And so far, we've been able to manage even the more severe or critically ill patients.
I can just imagine, Dr. Santiago, what your typical day would be. But um, for the rest of our audience, we'd just like to tell you and encourage you that we are praying for you at saludo kami sa mga sa bravery po ninyo at sa mga kasama nyo in terms of all the frontliners. And we are doing whatever we can also to help you on and battle out this pandemic. So my
Thank you
question
very much.
also to yeah, thank you. My question also to Architect Philip is that seeing this, would you want to tell us and share with us what your baby is or what your innovation would be that will address and help probably, because right now I've seen our healthcare industry being overwhelmed. So a lot of hospitals are ill-equipped, and at the same time, even our government hospitals like PGH and other government hospitals are also facing a lot of challenges in battling this because number one, ang dami talagang sabay-sabay na cases. So what can be done to help and augment this pandemic?
Yes, John, thank you. Thank you for having us both here, the good doctor and myself as well. You know, this was like around 5 weeks ago when we started this challenge. I just felt that there's a need to segregate the COVID patients from the regular patients. What I was noticing was the overwhelming uh, patients that we are already receiving. And the problem was I've already foreseen that the hospitals are going to be overloaded. And at the same time, we were wondering what would be the best way to ease the the overcrowdedness of the hospital. So this is where Project Medicube came about. Medicube is a mobile emergency dedicated ICU building extension. So you can either put this next to the hospital unit. You can also send this to the provinces where this particular facility is needed. It all depends, no? But basically, what we want to do here is to segregate the COVID patients from the regular patients so that now the pregnant woman can just go to the hospital and have a normal delivery. The dialysis patients can also go to the hospital and do his procedure, so on and so forth. No, even the person who probably have a broken arm or something, he can still go to the hospital and look for his ortho. No? So basically, I think that's what we really wanted to do. We wanted to share this knowledge with the public.
So architect, basically coming from a layman's point of view, non-architect, non-medical practitioner, what you're actually saying is this Medicube, it's like a Lego toy that you can build, connect. And what's good
Mhm.
about this is that you can transport it to different cities or different localities nationwide. So you can do it via sea. You can also do it via land. But can you
Mhm.
tell us, in terms of mechanically, how do you go about it, and how does Medicube works? Apart from
Okay.
the name is very catchy, it's nice. It's actually an acronym pala. It's a medical ICU. What's the BNE?
building extension.
Building
But we don't
extension.
want to
So
confuse the people, no. But the
yeah,
thing there is maybe to summarize everything. When we went about with the design, we started to visualize how we can construct a mobile hospital quickly,
mm,
fast, no, with sturdy shell, and it's really something for the long run, no. So what came to our minds was let's use container vans, but just not just the normal container vans. It should be the 40-foot container van and also the high cube. Now I'm talking about technicalities also. That's practically the biggest container van unit that we can use. No, it's combining three items. Maybe Ken can share some of the images there so that you can see that these are three container vans. No, and these series of container vans will be fitted out off-site. The reason why off-site is to protect our workers, no, and will be able to be transported to the designated location later on. Now, there will be a delegated time frame allocated for the construction, and then another time frame for the subcons to come in. And then after this, the site preparation for the foundation, for the steel ramps, this will actually go in concurrence with the construction of the fit out units, no. And then of course when I say the tapping points and the electrical and plumbing requirement, it will be done also off site, no. Sorry, at the site, awaiting for the completion of the Medicube. With that in mind, we're trying to prepare something that will be delivered right away. Now, to answer your question also, yes, we intend to have this for the long haul. In the event that the pandemic is over, then these facilities can also be shipped. Let's say you put this in a parking lot of a hospital,
mm,
right? And then let's say after the pandemic, and then we go back to our normal lives, people might say that, oh, this is just going to become a white elephant here. Not necessarily. The intention is for the future as well. We can ship this to the provinces where people are really in need of this facility.
so basically, this ICU facility is, you mentioned kanina, it's transportable. It can be expanded as the need arises. Then what's good
Yes.
with this one is that, yun lang, parang it's not only for single use like this pandemic, because we know that for sure there will be new strains, there will be new virus that will come out, and we will again be overwhelmed. Our medical system will again be overwhelmed.
Mm-hmm.
So
Mm-hmm.
that's the intent for Medicube. I'd like to ask
Mm-hmm.
Dr. Santiago as well, because initially you mentioned that you have only 15 ICU beds, and then that's a mix of your current COVID cases and the non-COVID cases. So my question would be, how will this Medicube help in terms of the way we segregate our patients, or the way we handle our patients with different cases, the ones that are having COVID, the ones that are still PUI, and the ones that are non-COVID related, that who's afraid to go to the hospital because they're afraid that they might get infected.
Okay. First of all, I would just would need to correct you. The Philippine General Hospital has 12 ICUs. So not
Mm-hmm.
beds, but
Not
12
50.
different ICUs.
Oh, 12 ICUs.
Surgery,
Oh,
OB,
oh,
all different types
there,
of
there, there you
ICUs.
go, there you
And
go. Oh, oh,
each
oh, oh.
unit would have from 6 to 15 beds.
Okay.
But this is for PGH. But for
Mm-hmm.
most
Mm-hmm.
government hospitals, especially the smaller ones, they would just have 2 to at most 5 beds in their ICU, and that would just be one ICU for the entire hospital. So this would be the smaller hospitals. Now, the Medicube would definitely be of benefit because this can augment the number of beds. So right now we don't have that overwhelming number of cases, but in the event that there is a second wave and that there are a lot of patients, critically ill patients, definitely because as far as I can remember, the total number of ICU beds in the Philippines would just more or less be around 2,200 nationwide. So
Mm.
that would be for the entire Philippines na. And
Wow.
there would be some cities, municipalities who do not have ICU beds. So in the event that we have a lot of COVID, the severe COVID patients, then this can be transported, this can be set up even in the smaller facilities, just get the manpower, and this can augment the current number of beds. So definitely this would be of benefit. And it's not just for COVID, as Architect Lou had mentioned. Even after or beyond COVID, this can be utilized and can be given to the smaller hospitals. Just place it in an area, even the parking lot, and this can be set up for the critically ill patients. So most cases that we see before COVID would be those who had developed strokes, who had developed myocardial infarction or heart attack, the COPD exacerbation. So at any given time, there would be a lot of patients who can potentially benefit from this innovation.
So we're looking at a possible extension in the event that this goes wild, and at the same time we will be overwhelmed. So at least we
Long,
have a backup system for us. But would that mean that if this will be an extension of an ICU, it can be used to handle COVID cases, or also separate non-COVID cases in that single facility?
yes, because it will depend on the number of cases. So if you have sufficient space around or adjacent to your hospital, you can set one MEDICUBE for PUIs, the suspected cases, and one MEDICUBE for the non-COVID cases, and then even one more for the confirmed cases. So we can segregate the cases that we have. Those who have confirmed COVID in one MEDICUBE, those who we still are just suspecting and are unsure of what they have in one area, and those we are sure that are already negative, then we can place them together so that there would be no cross-contamination between the different patients.
I like that term, Dr. Santiago, cross-contamination. Because
Mm.
as we know, I was talking to Architect Philip before that my dad was in an ICU a few years back. Not an ICU, but he has a lung problem. But he ended up developing pneumonia because of the hospital's might as well air circulation system. So my question would be, si Architect briefly mentioned about airflow, and also
Mhm.
plumbing. Considering this one is gonna be transportable, how will you go about with the airflow circulation and also the plumbing and sanitary for this Medicube?
Okay, thank you, John. Yeah, sorry, I was not able to discuss the details with regards to that. That's actually the main point of Medicube. It's an extended ICU facility, but we try to even further improve the normal ICU facility, meaning the air exchange is concentrated here. Now, this is one of those facilities that we will practice 100% negative pressure on all isolation rooms. Now, Project Medicube has 8 rooms right now. There are 4 that is actually bigger than the other 4. The 4 bigger rooms will be catering to the more severe patients so that the doctors and nurses will be able to go around it, go around the patient. Now, negative pressure. What's negative pressure? Basically, we're sucking all of the air out from all of the isolation rooms 24/7. Now, there are 3 compartments. If you can look at our image there are 3 compartments there. There are 3 container vans. Now, the middle container van is positively charged with clean air. Not that I'm saying that the rooms are contaminated air, but once you put a patient there, basically the room becomes contaminated. Now, when you remove the air from each of those rooms, there will be a vacuum inside those rooms. Now, the positive air is on the middle chamber. So the middle chamber's air, the positive air, will now go to the individual rooms. Now, constantly yan. That's why we're also introducing fresh air in the middle chamber. Okay. Now, the thing here is that the important thing is to clean the air. So any air that is coming in will go through a two-stage HEPA filtration system with a MERV 8 and MERV 13 rating. No. This was designed by JSR engineers. They are also they're really versed in this particular case because they also did the HEPA filtration system for San Lazarus HIV Training Center.
Mhm.
Okay. Now, when we suck out all of the air, before we throw it out of the atmosphere, we also clean the air. Now, this is what makes the facility different from other facilities because what we're trying to do here is we're trying to care not only for the environment but also to the people around the facility. No? Now, it's very important that in our quest in doing something like this, we also make sure that what we're doing is right and it's safe for the rest of our the general public per se. Now going to the plumbing naman, with regards to the plumbing works, uh, most of our plumbing works are exposed so that the maintenance is also easy. No? And of course, the necessary genset and the pumps are also uh, prepared for this particular facility.
So it will be easy to tap into the existing connection of the hospital if it will be placed in the parking lot of the hospital. Or in this case, it is also possible to connect it to a non-hospital, like parang plug and play din ba siya, that you can connect to the sanitary and plumbing at the
Yes,
same time. When you get the Medicube, you have in there the filtration system already built in.
yes, yes. Everything is already built in. No, what we need here is do not mistake it. Na it's going to be run by a genset. We discourage this. The genset is just a backup power. It should still be on grid. So meaning, if a hospital has the facility has enough power to power our Medicube, then that's good. No, but in the event of power failure, at least a genset will always be there. Now, with regards to the plumbing as well, there is also a prefab septic tank that will receive all of the discharge of the facility. Now, preferably, we will also tap into a water source that will also give ample water supply to the facility. But then again, the pressure is very important. So we also have to integrate the proper pumps and the cistern so that the water is always prepared. No? It's always upon demand, we will be able to provide.
Yeah. Architect, maybe we can show our viewers like what Medicube looks like, right? For that slide that says what
Mhm.
are the major components of Medicube, and then how you can parang expand it or interconnect it. From what you mentioned before, it can be single level Medicube, it can be two-level Medicube, it can be expandable like a Lego block to house not only 8 beds but 16 beds. But for the purpose of illustrating it to our
Mhm.
audience, maybe we can share the screen and um, take us briefly how
Yeah,
it will look like.
sure. Ken, maybe you could help us with the screen, Ken. So this one here is the start of the construction. So basically we have three container vans and then we prepare it and basically you put it all together. Now, all of these container vans, the intention is for them to be shipped to the general contractor's site so that everything will be done off site before it's going to be shipped to the designated location. No? Maybe the next slide, Ken. There you go. No? So here we're showing the section and all of the details of the walls. The walls should be insulated properly. As you can see that container 1, C1 would be the rooms, and then C2 would be the common area, and C3 will also be a series of rooms. No? So once everything is finished, it will not be connected yet. It will be connected at the site later on.
So this will be shipped as a per container pa rin, 40
Yes,
foot container, 3 sets. But you
three
are
sets.
already building the insides of it so that when it arrives on site, you're gonna connect
Mhm.
all three. Magbo-vault in na lang
Yes.
silang tatlo.
Yes, correct, correct. Yeah,
Wow.
they will just like sort of like be connected with each other. Now, the next slide will also show you the details of I think it's the insulations, ba, Ken? Okay, these are the insulations that we're going to use, different kinds of insulation. Now, it's very important that not just the exterior wall will be insulated, including the interior walls. No, the reason why we're doing this is also to achieve soundproofing between those rooms as well. The ceiling is also insulated. No, again, this will help our air conditioning system. The air conditioning system will not be overworked. Okay, next slide, Ken. Okay, now this is how it looks more on the, how do you say it, more realistic side. So the green area on container 1 are the insulations. No, we're using EPS for this particular project. And for the flooring, we're also using a hospital grade vinyl flooring, which can be cleaned properly. So basically, once you're done with all of this, you ship it, you don't connect it together, you ship it to the site. The next slide will show you our roofing details. As you can see, container 1, the orange one, is already complete. And then container 3, which is the green one, is also complete, including the roof. But the middle portion will be assembled at the site because there's an overlapping of the roof so that we could ensure that there's no leak that's going to happen between the 3 units.
So basically,
Very good.
you will ship all the individual containers plus the parts like the roofing and the insulation separately, and that will be assembled on site.
Yes, yes. But this will dramatically lessen the work at the site. Again, because if we're going to work, let's say, on a hospital environment, we're not really sure of the environment. So we're trying to uh, give the best safety precaution to all of our workers that will be involved in the project.
Just a quick perspective lang, architect also, is that
Mhm.
for us to ship it, how long would it take for you to assemble the whole thing and put it all together?
As I've spoken to two of our nominated contractors, I think they can finish everything in 1.5 months. So that would be probably the lead time. And while they're doing the 1.5 months fit out construction, the foundation and the ramps are also being constructed at the designated site. So once you ship it there you'll also need the assistance of a crane to put them all together.
But the MEDICUBE, this will be built here in the Philippines ba, or will it be coming from outside?
Oh no, definitely everything is here in the Philippines. We've also all of our suppliers are local suppliers. No, we've also reached out to some of our friends in Cebu, and there's also a nominated contractor there. We're trying to work with contractors who are really capable of building and delivering. No, so definitely it's all local.
Okay, wow, that's really good also because that will also help spur the environment, especially those heavily affected construction
Yeah.
sector, those that have no work. So this is a very brilliant idea. No? My question also, architects, that has has there ever been something similar to this one that were built previously, or are we seeing this also present in other countries, or wala pa talaga?
There are similar projects that I have seen. Also here in Makati, there's also something similar to this. There's also some being built in Santa Rosa. So for me, the more people who could contribute with a similar function like what we are doing, as long as it's going to contribute for the good of our people, we really welcome this, no?
Okay, so can we basically you also mentioned about that aside from the rooms, there's gonna be quarters for our healthcare professionals. Because it's if it's gonna be a separate facility, we also don't want our doctors going into the regular hospital and then going out to see other patients, or it might be prone to cross contamination. So my question,
There,
what are the amenities or what are the things naman that we can provide for our healthcare practitioners who are also manning and risking their lives seeing these patients that are infected?
okay, good question. No? That's why when we were doing Medicube, it's not just Medicube. We have to give the proper care and assistance to our medical practitioners. So that's why we were able to design another unit where we will house all of our medical practitioners, the doctors and the nurses. Now, the original design that we made here is actually one communal area, thinking that the doctors and nurses are not infected, so they can just sleep together in one big room. No, but I was actually corrected by our good doctor. Again, this shows our doctors and nurses room. We individualized it also. We compartmentalized all of the rooms. Now, I was told by one of our contributors that, do you know how our medical practitioners sleep in the absence of isolation rooms? So they basically sleep with their N95 masks. This is like really terrible. It
Wow.
breaks my heart. No.
Mhm.
So in order for us to give them the proper care, we gave them individual rooms where they could practically remove their mask, have a good night's sleep, and be properly rested so that they could be they could be more productive the following day. No, I also realized that all of our medical practitioners, including Dr. Joel, once they involve themselves or immerse themselves in people who are infected, they automatically they would become PUIs as well. No, so this is the second floor. The first design that we made here was there's a big cafeteria so that they could congregate. Now, we realized that was also discouraged through Dr. Dennis Serrano. No? He is the head of logistics for PGH Corona Crisis Committee. Now, I asked the good doctor, how are they going to eat? Now, these warriors will just get food, pack meals, bring it to their own room, and eat in
Mhm.
isolation.
Mhm.
Once you really get to know how they act, these are their daily. This becomes a daily chore for them. No, now I really wish that the public would really know the suffering of our medical practitioners, the sacrifices that they are giving to the public, and there are still people going out without masks.
I
It's
like
really
the
terrible.
idea. Yeah, I like the idea no, of taking care of our doctors, our healthcare practitioners, because at the end of the day, if we don't take care of them, how can they take a good care of our patients? Diba? If they're not well rested, they don't have proper hygiene facilities, they don't have a place where they could rest. Kasi you cannot expect our doctors to work 24 hours straight. They're not robots. They also need to rest.
If we do not take care of our medical practitioners, what will happen to the general public? That
It's
is
gonna
what
be
really scares me.
Yeah, but it's gonna be very difficult considering that the government needs our help. It can't be just government lang building and providing hospitals. That's why we also want to enjoin. If you're a business owner, if you're a local government unit, or if you're a company who wants to help out and you're not sure how you can help, this Medicube might also be an avenue for you to use and to interact and also to make a positive change for our community in the Philippines. Siguro, we can show them, architect, what, like you mentioned, there's a one story and a two story. What with
Mm-hmm,
how it will
mm-hmm.
look like,
Sure,
from the, if they're gonna
sure,
look at it from the outsider's perspective, yung one story
right,
and two story.
sure. So, okay, going back to our structure, this is the one-story Medicube, and this is also we just put one on top of the other. This is the two-story Medicube building. No, now the one-story Medicube building can house 8 ICU facility, ICU or AIIR, and the two-story Medicube would house double. So this will become 16 rooms. No, there.
It's really plug and play, so you can just get a
Mm-hmm.
huge parking lot. It can even be placed in a gymnasium, and at the same time you can just install it, as what architect mentioned. It will take about a month to a month and a half to put all these together and assemble it,
Mm-hmm.
but once it's
Yeah.
up and running, you have a running ICU facility anywhere in the Philippines.
Correct, correct. And
Wow.
John, you also mentioned, no, of course, we're giving options because one of our contributors also mentioned that it's quite imminent that the cases will continue to rise. Now, this is the reason why we also facilitated the last piece of the puzzle, which is the hybrid extension. No? Uh, so the hybrid extension is practically putting two more units to the existing two units. No? So Kent, maybe you could show us the image, the isometric first, and then the final finished product.
So it's like a building block talaga that you're gonna connect one from the other. So it depends on the need. One Medicube block might cater to a smaller city, but if
Yes.
you have a bigger city which has more population or possibly more cases
Mm-hmm.
infected, you can connect it. Okay, that's a
Correct.
hybrid extension.
So yes, this is the hybrid extension. So the gray portion is our original Medicube facility, no? And the left side would be the other extension. It's basically identical plan to the original Medicube building. However, we for this particular extension, we got rid of the donning and the doffing off portion because everybody's still going through the same process of just one entry point, no? And the on the other side is actually the entry point of the patients, no? So only one entry and exit, so ingress and egress. Now, with the additional 8 more rooms. Now we'll need a space for storage for the
Mhm.
equipment and also for the housekeeping. So the two areas that were removed is now replaced with the housekeeping and the storage for the equipment facility.
Wow. So combining Medicube plus the hybrid extension, essentially you will have 16 ICU rooms
Yes, yes,
combined.
16 ICU rooms, and then if you put the second floor, so you multiply it by two, so that's 32 ICU facility.
Mhm. So, for example, architect, one city will need one more than the other, but you also mentioned that it's easily transportable. So, say for example, one Medicube is placed in say Manila, but then
Mm-hmm.
again, cases in Manila has started to go down, and there's a need for us to
Mm-hmm.
ship to, for example, Pampanga. Um,
Mm-hmm. Mm-hmm.
what would be the lead time for us to disassemble it and move it to Pampanga as well? So ganun din ba, 1.5 month, or it might take faster time?
I think it should be faster because everything is already there, no? But I have to go back to my drawing board because we have to discuss this together with the contractors since they're the ones who will be building this, no? So basically, we would probably the best people who would be able to answer this would be the general contractor.
Mhm. Okay. So at least parang from what was explained early on, it will be for multi-purpose use. It's not gonna be used just for this pandemic because who knows
Mm-hmm.
what strain will come up in the future. We don't mean to
Mm-hmm.
scare our audience, but we just want to be realistic lang din na the world has virtually stopped by facing this unprecedented pandemic. But we have to think forward and think progressively on how we can help and ensure that
Mm-hmm.
there will be less contamination. And Medicube is one that can answer that in terms of augmenting and elevating the standards of what we do in our ICU today. So
Yes,
actually,
correct, John.
architect, you've explained already how it works, and also for Dr. Joel kanina who joined us, but he had to leave lang. Um, you've already explained to us about this one, what problems it can solve. It looks like this is definitely something that we need. So I guess the question on everyone's mind is that how much a facility like this would cost and how many is needed per hospital or per city.
Okay. With regards to cost, all we have right now are ballpark figures because in the absence of we're still on lockdown, so even our suppliers are still in a bit of disarray. But to give a quick count, we are reaching at around 4.5 to 5 million for the Medicube project. No, of course, the cost is quite high, I would say, but we also have to think about what do we want for our people? What do we want for our nation? Do we want results or do we want to invest on something that is not so expensive, but it will not yield any results? That's the big question. Now, we just feel that this is one of the projects that would really give us some good results. And we have uh, renowned doctors who are contributing their knowledge. This is not just us. This is not just APL. This is not just JSR. We really try to get the points of our doctors. No, so correct. And with regards to the first wave or even the second wave, as we were mentioning, right now, if the numbers are down, the people are not yet coming out. Now, we're trying to be realistic here. We don't want to be a pessimist, but basically, we also have to be realistic. Now, everybody should really do their part. And this will become our new norm. This is really the new norm. And unless a vaccine is is invented or is out in the market, this virus is just going to stay here with us.
You mentioned kanina na we will be needing this as much as possible because there are areas where we don't have a proper ICU or a proper hospital. So I am enjoining also to our local government officials or LGUs, if we know this is something that you need, so we also would want to call on our corporate big companies, the likes that have investments everywhere in the country. If you'd like to help, this can be an area for you to practice social and corporate social responsibility. If you'd like to know more about Medicube and how you can help partner with them and also like adopt a community, adopt a local government unit, or if you're a company who want to put it for your warehouse or for your staff needs, it can be a mobile ICU. How can they get in touch with you, architect, and your team?
Now, we have the practical blueprints that will the construction plans. No, so you can contact us right now through these numbers. We're not holding office at the moment, so everybody's working from home because of this pandemic. No, so we can entertain your calls through these lines, and we'll be happy to help. Thank you, John.
So yeah, so everyone, this is a worthy cause, and this is something that will really be a very good response on how we deal with the pandemic, and it's something that we can pass on one city to the other. not passing on the virus, but passing on the facility, passing on the technology. And what's good about technology nowadays is that we can do virtual meetings like this one, and without really going out of the office. I'm sure si architect is wearing a coat. Ako naka-coat but naka-shorts lang ako sa ilalim. So this is basically the new normal.
Yeah.
Yeah, but Medicube is really a worthy cause, and we hope you get in touch with our good architect. He'll explain all the details along with the medical practitioners that they are working together with. So this is not just a construction aspect, but it's really something that is hinged medically as well. In fact, I was telling architect, if I didn't know that he was an architect, when he was explaining to me initially about the filtration system and the plumbing and the likes, I would think that he is a doctor himself. So things like this we really need, and we hope that you would reach out to architect and his team so that we can partner. It's all about helping each other and helping the community. So that is our role as a broker. We're not only brokers for real estate needs, but we're also brokers in making sure that our community can thrive and can help each other during times of crisis. So architect, any parting words before we go?
Oh, um, well, John, this project really, the inspiration here is the medical practitioners. No, we dedicate this to them. When we were interviewing the doctors, we were also interviewing Red Cross respondents, and they were a big help as well. No, and we have to make an effort really to save our medical practitioners and our people as well. So uh, we just hope and pray that all of this pandemic will end soon. Thank you, John.
Thank you. Thank you very much. And we also salute you, architect, for coming up with a worthy endeavor, which will save, if not hundreds of thousands, to millions of people, because this will be a legacy that you will pass on. So we'd like to join again. If you're someone who wants to donate, if you're someone who wants to partner, do contact them, because at the end of the day, we just want to help out. So guys, that's about it for Medicube. And thank you very much for joining us. This is John, your favorite broker from Remax. Until our next session. Bye guys. Thank you.
Bye, John.
Hi guys!